Hello everyone, you are welcome to the pharmacy. My name is Paul Abdurrahman Issa Doona, Parrot for short. So you enter into a pharmacy to ask for any medication, and the person behind the counter starts to ask you questions. Who is the medicine for? What are you using it for? What is wrong with you? Who sent you? Is the pharmacy not there to sell medicines? Is it not your right to be given the medicine you are asking for? Why is the person behind the counter asking you so many questions? Shouldn't he just give the medicine to you and then you go your way and continue with your life? In any case, if you were well, will you come into the pharmacy? You were there because something is wrong with you. So why are they asking you all these questions? That is the essence of today's episode of the program. In today's episode, we are going to look at the rights and responsibilities of a patient, the rights you have when you go into the pharmacy, and the responsibilities associated with those rights. What are the questions that the pharmacist or the person behind the counter is supposed to ask you? What is he not supposed to ask you? Do you have a say in what is given to you, or you do not have any say in what is given to you? These are the vexed matters that we are going to discuss in today's episode of the program. Let's catch you after the break. You are welcome to the pharmacy.
Promo is here again.
Buy a pack of Happy Delights and stand a chance of winning a brand new PlayStation 5. Here is how to win. Buy Happy Delights, follow our social media handles, follow the flow, take a picture of the top of your pack that shows the batch number, production date, production time, and keep it. Dial *899 *68 hash. Enter name, enter region and city, enter batch number, enter production date, and enter production time. Remember, the more Happy Delights you buy, the higher your chances of winning. This promo ends on 31st December. Share the happiness. Good life with healthy life.
Thank you very much for staying tuned. You are welcome back from that short commercial break. As I indicated in the introduction, today we are going to look at the rights and responsibilities of a patient. When you enter into the pharmacy, do you have any rights? Do you have any responsibility? Are you entitled to anything you ask for? Is the person behind the counter entitled to counter anything you ask for? These are the vexed questions that we'll be seeking answers to. And I have with me Pharm Adams Akram. He's a pharmacist with M Pharma. Pharm, thank you for coming.
Thank you for having me.
I also have Braham Opoku Jemfi. He's a media practitioner from the National Film and Television Institute. As you know, the nature of the program is that we bring a lay person to bring the layman's point of view to the topic we are discussing. Call him your representative on this show. Braham, you're welcome.
Thank you.
How are you?
I'm good.
Everything cool? Yeah. So let's shoot straight into action. Maybe I'll start with you, Braham. When you go into a pharmacy, do you go thinking you have certain rights? Do you go saying, I know my rights?
Well, I think it doesn't really occur to you. Yes, because for the lay person, you are seeing the pharmacist or the health practitioner as someone who is supposed to help you. So normally, we go assuming a humble position. So you don't even, nothing strikes you to go and argue.
Okay.
Yeah, so you just go and sometimes whatever they administer to you, you don't even question. So I think it may be a few people who would know that.
But I'll come to that. I'll come to Pharm that I know there are people who come and then they want to show you they even know more than you. Maybe they've Googled what they are come to ask for. So they are coming with their Google information. So Pharm, what are the rights of patients in the pharmacy?
So I think it has to be clear and put into context. As a patient, you have a right to health care. As well as a patient, you have responsibilities that you have to oblige to. I think within the landscape, not just pharmacy, but within the health landscape, we have regulation that are supposed to guide these things. If you look at the Public Health Act, Act 851, within it, I think on the 6th schedule, it talks about the patient charter.
Okay.
And the patient charter basically serves to indicate what a patient's rights are, what their responsibilities are. And then on the flip side, as a patient, I become a patient when I walk into a pharmacy, when I walk into a clinic, anywhere for healthcare delivery. And so that facility or entity also has responsibilities that they have to honor to you.
Okay.
And so as a patient, I think when you look at, so far when you look at the landscape, being in practice for a while, I tend to prefer the scenario where a patient comes in and want to advocate and say, this is what I want, or this is what I think I deserve. It being right or wrong is a totally different issue.
Okay.
But because of where we are coming from, it has to start from somewhere.
Yeah.
Of course, it's not always right, and that is where, as healthcare people, you also owe it a duty to educate people. I can tell you that not many patients know that there's something like the patient charter. They don't know the rights that accrue to them when you walk into a facility. So for me, I think that the sensitization is important, and people have to understand what they have to do and what is expected of them.
Yeah.
I'm sure when we go into the nitty-gritty, we probably will kind
Yes,
of
because I was going to pick you up on something you said, that you'd prefer people coming in to say what they want. I've also been in the pharmacy for a while. Yeah. The person comes and says, I want, say, paracetamol. Even when you ask, what do you want the paracetamol for, the person can get angry. I said I want, so give it to me. Is this what you are saying, that once the person comes and says, this is what I want, is the person's right that you give it to the person?
No, not at all. So I'm coming from a place where, so if you look at certain jurisdictions, beyond, let me say, Africa, people know their rights. They know the limits to which they can ask for certain things. But I only brought that in because you have a certain, most of the people, let me use Ghana for example, people are as shy, they are scared, and things that you ought to know, you ought to demand, you don't do it. And so once you leave once you leave yourself in the hands of an unscrupulous healthcare practitioner, then you stand the risk of being harmed. But exactly why the charter is there. So within the charter, it sets forth that a patient is entitled to comprehensive health care, regardless of your age, gender, religion, ethnic background.
Okay.
And so the patient has to have the ability to get that care, irrespective. Once I see you, I don't need to ask where you are from, who you are, what is your age. I should be able to offer you that care.
Okay.
And so once the patient understands that, within that same scope, when I walk into a pharmacy, since we are within the pharmacy, when I walk into a pharmacy, and maybe I have a condition, I have a headache, I have a pain here, and the pharmacist or whoever's at the pharmacy goes to pick up something and says, okay, take this number of times a day. As a patient, what am I being given?
Okay.
And then it's so clear that as a patient, you have the right to know that, for example, if I walk into a pharmacy and I see somebody standing there, first of all, is that pharmacy registered to operate? Is a person in there a qualified person that can give me good care?
Yeah.
So I need to understand all of that as a patient. I also then need to understand, if you give me something for what I've complained about, what does it do? Why are you giving this to me? What should I expect?
What do you mean by what does it do? You came, you said you are sick.
Yes.
I've given you the drug.
Yes.
It's supposed to cure your disease. What do you mean by what does it do?
So it's not that simple. So that is where a gray area exists, because if I give you something, you come have a headache and I just give you a drug and it says for your headache, it probably doesn't cure the headache. So I can ask the pharmacist, a patient, okay, this drug, what is it called? What does it do? So the pharmacist or whoever is there can explain to you that this is what it does. As a patient, you on your own can then, even outside of the health setting, be able to look into what you've been given, and you can ask questions.
Okay.
You may not be able to ask them at that very moment, but then you should be able to understand what has been given to you, and on your own you can do your checks and be able to say, okay, I think I was given the right product.
Okay, so now Now you've mentioned just one of the rights, which is the right to access to comprehensive health care.
Yes.
We'll come back and talk about more. But let me go to Braham. How does this right that you now know exists come to you?
Before that,
Yeah.
I wanted to ask, because you made mention of something that you said it is our right to know, or we are supposed to know whether a facility has been registered. And okay, so I walk into a pharmacy,
Yeah.
and I'm not feeling well. All I need is medicine. Give me. What time do I get to go and be asking all these other questions? Or are there ways I can just enter into the pharmacy? Are there things I will see and know that, okay, this one is registered and I can trust this facility?
Yeah, so you're absolutely right. And the expectation is that being in practice, we have the Pharmacy Council that is supposed to ensure the highest standards of pharmaceutical care practice. And then you also have a professional body, the Pharmaceutical Society of Ghana, whose major role is to ensure that the people who call themselves pharmacists are able to do the work and do it well. And there's also monitoring ongoing. So really, as a patient, your expectation should be that when I walk into an outlet that says a pharmacy, your expectation should be that, or our expectation should be that it's been properly set up, it has gone through all the regulations, and the people there are up to scratch. I can vouch that these people there, or these facilities that are there, have gone through the processes, but in a system such as ours, it cannot be foolproof. And as a patient, you can actually ask, can I speak to the pharmacist in charge? By law, any pharmacy you go into must have a pharmacist present at all times.
Indeed. Fam, not to cut you, so that we don't go off rail. This topic actually is treated in one of our episodes, so I entreat viewers to watch and get the full details of how you notice that the pharmacy you've entered into is properly registered and is doing the right thing. We have an episode on it, so the viewers, please check out that episode. It's a very important question, and I entreat viewers to watch that episode and get all the necessary information from where Farm has left off. Now, quickly, before we go for another break, how does the knowledge that when you enter into a pharmacy, you are entitled to have comprehensive health care come to you?
I think it's good news. Yes, it's good news because it's going to enlighten us and then help us to. I don't know if I should use the word demand.
Okay.
But we are going to be responsible in a way. We are not just going to enter into the pharmacy and just take anything that we are given. And then if we also know these rights and responsibilities, like he rightly said, we will also be careful not to go beyond the line where we will be arguing too much with the pharmacist. So I think from a lay person's point of view, this is good, and I would even be happy if we can keep championing this so that everybody will get to know. Okay,
so viewers, Fam, we'll come back to you from the break. So you ran us through the remaining rights we have and the responsibility there are for all of us. Viewers, stay tuned. We'll be right back.
Time has so. The other promo is here again.
Buy a pack of Happy Delights and stand a chance of winning a brand new PlayStation 5. Here is how to win. Buy Happy Delights. Follow our social media handles. Follow the flow. Take a picture of the top of the pack that shows the batch number, production date, production time, and keep it. Dial *899 *68 hash. Enter name, enter region and city, enter batch number, enter production date, and enter production time. Remember, the more Happy Delights you buy, the higher your chances of winning. This promo ends on 31st December. Share the happiness. Good life with healthy life.
Welcome back, viewers, from that break. Before we left for this break, we had already spoken about the fact that when you go into the pharmacy as a patient, you have some rights as per the patient's charter. And Pharm Adams had intimated that one of those rights is that you have the right to comprehensive healthcare delivery. So that's where we went on break. Now we don't have much time, so I'll give Pharm Adams some time to go through as many of the rights and, in fact, the responsibilities as is contained in the patient's charter for the elucidation of the viewers.
Yes, so quickly into that. So from where we left off, as we all know, the charter is to ensure that the rights of the patients are well protected and they have access to comprehensive health care. But also as part of the patient's rights, broadly speaking, a patient would typically have the right to know who my health care giver is.
Okay.
Whatever alternatives that are present, the expectation is that the patient can demand to understand, not demand. When I say demand, I don't mean go fight somebody, but you can definitely ask that what am I being treated for?
Okay.
You can also ask for what are my options.
Yeah.
Within those options, the patient also has the right to say, okay, can I seek a second opinion? Based on that, the patient can determine on their own that this is the best course of action that they have to take.
Okay.
As well, for the health facility or institution, they also owe the right to, if the facility has certain rules or certain tenets that a patient must abide, you need to carefully and properly make the patient aware of those rules so that they can understand and make informed decisions.
Okay.
In instances where a patient is ill and is unable to offer suggestion onto their treatment, then it's expected that a guardian, a legal guardian, or someone who's taking care of them should be able to do that for them.
Yeah.
And if the person is a minor, then the person is also expected that a guardian, legal guardian, should be able to offer that suggestion in place of the minor. The other things that, for the purposes of the show, which is more of the pharmacy, our attempt that we limit ourselves to the scope of the pharmacy.
That's
because
fine.
most of it asking to understand what I'm being treated for, what options are there, maybe in the clinical setting, in the hospital. I may want to understand, okay, this is a drug I'm using drug A, B, C, I'm on admission and all of that. But within the pharmacy, purely you walk in and then you say to whoever is available that this is my symptom, this is what I'm feeling, for which I've come in. And then you expect that you are given the very best form of care. And while that delivery is ongoing, you are expected to make inputs. Okay, what are my options? Or why this? Are there any side effects that come with it? And so as a patient, you need all of that. So when you are given a medication, it's not enough to take it and walk away. So the idea is not for a patient to go in and start to question or want to fight with a healthcare giver. The idea is that as a patient, there are very basic things that, I mean, of course, because of the structures put in place, you should expect to find a qualified person in a proper setup. But I think as a patient, you need to understand what is going on with you. It's your health. It's your right to know. And I think that a patient should be able to ask, of course, in a courteous manner, respectful manner, that I'm being treated for this. What is this for? What is that drug for? What am I to expect when I take it? How soon should I take it? What should I do when I have a certain effect that is not of the same indication that you've told me? And then as a patient, you yourself have responsibilities. So it is not a one-way street. You don't just go, someone has responsibility to you and you don't have any. You have responsibility. So one of the key ones is that in being offered treatment, you need to be able to, for your primary caregiver, you have to give them the best history possible.
Okay.
This is what I've had. So it gives them the full understanding.
Yeah.
It is also a responsibility that in the course of treatment or in the course of having an interaction with the healthcare giver, if he notices that there's something you mentioned that is not clear, they can come back to you and you are expected to offer an explanation or give much more reasonable meaning to what you said as a patient. So at the end of the day, the ultimate goal is for the patient to benefit. The life of the patient is key, and everything that must be done to protect it and give them the best care has to be made available.
Just quickly on the rights. So for instance, when somebody comes into the pharmacy and complains of a certain disease condition, and maybe as the pharmacist, you decide to give him an orthodox medicine, and the person says, no, if there's a herbal medicine equivalent, I want that one. Is the person entitled to that? Is it the person's right to say that, don't give me orthodox, give me herbal? And the pharmacist, I see herbal medicines there.
Yeah, by all means, but I think that it has to be cleared. So as a treatment option, as the healthcare professional, once the option that the patient has proffered fits within the scope that you can treat the person for without any untoward effect, or by all means you are permitted, you should be able to explain the options to the patient to understand. It is not enough to say, okay, this is what I want to do and I'm not hearing anything else. You are obliged to explain to the patient. However, based on your experience and based on your training, you should also be able to explain to the patient, as a pharmacist, that okay, this is an option for you, this is an option for you, but based on experience, I think you should go with this alternative. However, if as a patient, you give me all those facts and I still want to push for an alternative, in as long as it fits within scope, I think that as a proper healthcare professional, you ought to oblige the patient, explaining to them what's going to happen, as long as it fits and it doesn't pose any adverse
So if I get you correctly, if I was to ask who has the final say in determining what medication we are giving to the patient, if I get you correctly, you are saying that in essence, it's actually the pharmacist, the trained person, but it has to fit within the context of what the patient also wants. Is that the case? Or is the patient who has the final say?
I want to say it this way, yes and no, and majorly no, because as a healthcare professional, I'm obliged to provide what options exist to the patient. Of course, then I'll expect the patient to say, okay, I opt for A, B, C. And it doesn't mean that in every scenario there are options. There are certain scenarios that this is what it is, we have to treat it this way, and so you still explain to the patient this is what we are doing. But where there are options, it doesn't lie within me to say, okay, I'm going to do, I have to explain the options to you. But based on your training experience, you then can go further to say, well, based on my training, this is what I think is the best route for you to take. Full recovery, maybe a better side effect profile. And so the patient is aware and then can say, okay, let's do it.
Okay, thank you. Bram, in 1 minute, with this information that we've had, will you say in the pharmacies are doing a good job in having this kind of tete-a-tete with patients to make sure that both the rights and responsibilities are aligned with what we are doing in the pharmacy? In concluding, what will you say?
I won't say all of them. I'll say some. Because personally, I've entered some facilities where I wasn't pleased with the services I received. Some of them too, I think, I don't know who to blame. So you are the professional. I walk in and I tell you that I want paracetamol. And some of them, they don't even ask anything. They just give it to you.
The paracetamol,
and then you go. Some of them to the extent that they won't even prescribe.
They won't label for you to take.
They assume that because you mentioned what you want, then you know. So
I think that I'll bring you back on the topic of the responsibilities of the pharmaceutical healthcare team, those who are working in the pharmacy, and what they are supposed to do, because this fits into that conversation. I'll bring you back. I can see you have a lot of energy and a lot of beef in that area. I'll bring you back so that you bend everything. But viewers, thank you for tuning in. This has also been a very wonderful episode. We've learned that as a patient, when you enter into the pharmacy, you have some rights and some responsibilities that you must at least have a fair idea of, so that it informs what you do and what you don't do. I'll catch you again next week. Thank you very much to my crew. Thank you very much to the production team. Until then, let me leave you with a quote from Albert Einstein. I quote, "We are all geniuses, but if you treat a fish by its ability to climb a tree, the fish will spend all its life thinking that it is stupid." Unquote. Find your niche and fill it. Catch you again next week. Thank you.